In your health news, next week is National Women's Health Week, and to honor that, we're educating women on the importance of health screenings. Did you know that 1 in 8 women will develop breast cancer over the course of their lifetime? 1 in 8 now. Now it's more important than ever for breast cancer patients to develop their long-term treatment plan that addresses both clinical and cosmetic outcomes. So joining us now is Dr. Mindi Beahm, board-certified general surgeon at Centerpoint and Lee Summit Medical Centers, here to talk about the importance of mammograms, and we're going to talk about some hidden scar breast cancer surgery as well. So thank you for joining us.
Yeah.
There has been a lot in the news here lately, a lot of debate almost about when to get your mammogram. No, you don't have to go this time. Now you do. Now you don't. So what is the guideline now?
Yeah, well, like you said, there is a lot of variability. And what we know about mammograms in general is that mammograms are really a really great screening tool for detecting breast cancers early. And so the purpose of a screening tool in general is to detect a breast cancer or detect any disease early before it causes symptoms or problems. So mammograms, specifically with like 3D mammograms, exactly, we're really able to detect breast cancers when they're small, before they're able to be felt and before they're able to cause problems for the patient. So, and especially before they're able to spread to the lymph nodes or other parts of the body. And when we're able to detect these breast cancers earlier, then they're more easily treated and the patients can have better outcomes. So as far as screening, the recommendations really have varied a lot. And I'd say that the major organizations, especially the American Society of Breast Surgeons, to which I'm a member, we still believe that the best time to start screening is really at the age of 40. And you continue that screening annually, once a year, until as long as you're in good health. For some women, that could be well up into their 80s or even 90. Now, for women who are at an increased risk of breast cancer due to a family history or other issues, sometimes that screening will begin earlier and may include imaging other than mammograms. But for right now, I think although there is some variability with some times when you can do every couple of years, our major recommendations are still that you get a mammogram once a year starting at age 40.
Okay, very good. And then once it is detected in there, God forbid, but once it is, there is all kinds of new technology and new treatments available. Let's talk about this hidden scar surgery. That has really been revolutionary.
Yeah, so, you know, what we know about breast cancer is that it's a really big deal. And so when patients get the information that they have a breast cancer, they're not sure what they want to do. And with hidden scar breast surgery, it's the same breast surgery that we've been doing for a long time with breast cancer patients, but it's approached in a different way. And so we're still doing the same lumpectomies or mastectomies that we had been doing traditionally, but we're doing them through different incisions and with a different approach. So instead of approaching the breast cancer from at the level where the lesion is, instead we're basically kind of tunneling underneath the skin to get to the cancer and making that incision in a place that's not quite as conspicuous.
Yeah.
And so the real advantage then is that it just takes the scar away from the breast so that when you look at the breast, you don't have that obvious visible reminder of the breast cancer.
Yeah, that constant reminder. It's that emotional piece for sure. Dr. Beahm, thank you so much for stopping by.
Thank you.
And for more information from HCA Midwest Health, be sure to go to KCTV5.com, click on the Health tab, and remind all your girlfriends next week that this is time to make your appointments.
That's right.